Welcome back, everybody, to the OPT Network. This morning, we're talking, sadly, about COVID-19, but what we need to know about our friends and partners here in Central Louisiana. I'm talking about Christus St. Cabrini Hospital and how they are on the front lines of helping us, hopefully, not contract COVID-19. Our guest this morning is Dr. Zapatero. He is a family practitioner here in Central Louisiana, and we welcome him to the show for the very first time. Dr. Zapatero, good morning and welcome.
Good morning.
So we see the cases rising daily, and I think that most people thought, just from our leaders, that we were turning the curve, and just because maybe we weren't hearing about as many cases here in Central Louisiana. But what do we need to understand about people who are what they're calling asymptomatic?
So, first of all, we were turning the corner, getting better. But about 2 weeks after Halloween, we started seeing an increase in rise of cases. And that really has to do with the virus spreading. And it's important to make sure we take precautions of social distancing, wearing masks, and washing our hands. And a lot of it has to do with, as you mentioned, people who are asymptomatic. So I may feel fine, but I may have the virus, not be aware, and I may be able to transmit it to other people. And no one would be able to look at me and say, he looks like he's sick, so let's stay away from him. So they may get close to me, not wear a mask, and that's how it spread. And Absolutely. It can also spread before they become symptomatic, like about a day before.
A day before.
And it's too late at that point if they were near someone.
And so is it a foregone conclusion that if I'm asymptomatic and I'm around you and you don't have the virus, but I have it, but I don't have the symptoms, that I will automatically give it to you if I'm not wearing a mask?
If the person who has COVID, if they wear the mask, it significantly decreases transmission. So you wearing a mask would, and if you are asymptomatic or symptomatic and have it, it's going to make it less likely that you're going to infect someone else.
Mm-hmm. What do we know about the virus in our area that we didn't know initially that is helping to better treat the virus?
For better treatment, in the first time when Louisiana got hit early on in the process, and we were specifically told, don't give a certain medication, dexamethasone. It decreases inflammation, but it can worsen mortality. So it was not given, but research later showed on that if people have a lot of inflammation, they benefit from that treatment. So we have seen a decrease in mortality as we've improved the treatment and management of the patients in the hospital.
Mm-hmm. And so there is a new form of treatment that is in the form of an antibody. Tell us about it.
Yes, we're really excited about this. It's two antibodies that are against the virus. They work with your body's immune system in getting rid of the virus. This is the same antibody cocktail that President Trump had. And President Trump felt that this helped him get better sooner. The research does show that it does decrease the people who take the medication. It decreases their likelihood of being admitted or having to go to the emergency department. So we are encouraged by the results.
Mm-hmm. So
it is important.
Okay, go ahead. I'm sorry.
It is important, though, to get tested early.
That was what I was going to go to. Okay, when should you get the test? If you've been exposed to somebody that has COVID, when should you get the test?
Once you start having symptoms, you should be tested immediately. The antibodies are most effective if it's within the first 3 days. There is an emergency use authorization, which allows it to be given for 10 days after you start having symptoms. But again, it is most effective if it's given early. And it's the people who are at high risk that it's very important, it's crucial that they be tested, be evaluated very early. So don't wait to get evaluated.
Okay, so who is going to be in line for this antibody
So first, people who are over 65
Okay.
or who are severely overweight with a BMI greater than 35, those people are at very, very high risk. Also, people who have diabetes, chronic kidney disease, people who have who are on immunosuppressive diseases or treatments. These are diseases that affect their immune system, so they can't fight the virus. Also, for people that are over 55, if they have high blood pressure, cardiovascular disease, or lung disease. And I also want to point out that some children, adolescents, would also qualify. So children between the ages of 12 and 17, provided that they weigh more than 88 pounds, if they are overweight for their gender and height, if they have sickle cell anemia, if they were born with a congenital heart disease, or if they have neurodevelopmental disorders, or if they rely on medical devices such as a gastrostomy tube or tracheostomy, if they have it, the family is going to know that they have these devices, or if they have asthma or other respiratory diseases.
So it's not going to necessarily be available to everybody, only the people in those high risk categories.
Correct.
So for the rest of the people that will contract the virus, what's going to be their protocol? That don't have any symptoms, but they lost their sense of smell, but they're not coughing, they don't have fever. What's going to be the next step for them?
So, the research on everything involving COVID is never quite as robust as we would like, but there is data that zinc, vitamin C are definitely helpful. Mm-hmm. They decrease the inflammation in the body. They work with your immune system. So those are things that people can take and are not going to be detrimental. Mm-hmm. And it helps their immune system. So those are things that they can try.
And so tell us a little bit about inflammation and what does that really mean and why is there so much inflammation when it comes down to this virus?
So the biggest problem with COVID, when we see that people get severe disease, because many people, they get the disease and recover without a problem. When they start having problem is the virus triggers your immune system to have a lot of inflammation. So there's a lot of swelling in the lungs. There's a lot of fluid just trying to fight off this infection. And it is all of this inflammation in the lungs that then make it difficult to breathe. And the inflammation destroys the virus, but it also does damage to the lung tissue itself. Mm-hmm.
And so what are we seeing in terms of the rise at the hospital, and what are the protocols for people who need to come in and see people like you, need to come in and see their family doctor, just to check? Right now, people are not wanting to go in, and hospitals and doctors may not necessarily want you to come in if you think that you've been exposed.
I have heard of some doctors who don't want patients that have symptoms to come in.
Right.
It's important for them to then go to an urgent care center, and there are urgent care centers that will see people. You can also
I wonder what's the difference? Why go to urgent care versus, because if you don't know you have it, then you really don't know. Nobody knows who has it because so many people are asymptomatic. Why is the urgent care a better fit?
I don't believe it is a better fit. I am a family physician. I see patients, and if they have symptoms, I'm happy to see them. I believe that the doctors that don't want these people to come into their office, they may be concerned about them exposing other patients. Mm-hmm. So that may be why. And some facilities may be better at trying to separate out patients who have symptoms from patients who don't. That may depend on the waiting area that they have. So here, right now, I'm at the Incarnate Word Clinic. When we have patients that are symptomatic, we put them into a room immediately so that they're not around other people. But depending on the office, perhaps they don't have that luxury, and they don't want them sitting out around other patients, perhaps exposing them.
Sure. Before we've got to let you go, Dr. Zapatero, tell people as we are coming into the holiday season, what the recommendations are that the CDC is saying people need to follow.
So the recommendations, and it's really important to an ounce of prevention is worth a pound of medicine, is really to try and avoid large gatherings. So particularly for Thanksgiving, try to maintain it to the family members that you see on a regular basis. Also, try and do social distancing, wear masks, and also wash your hands.
There you go. And for people who want to connect with this monoclonal antibody, what do they need to do? Is there a specific number that they need to call if they have been infected or they think they've been infected and they've had any of these high risk categories that you've talked about this morning?
Well, they should see their primary care provider, or if not, urgent care or ED. The physicians and nurse practitioners, physician assistants will evaluate the patient, order the tests that they can, and they can make a referral to send the patient to the Incarnate Word Clinic. Right now, the only place where we're distributing it is at the Incarnate Word Clinic, but they can start the process at their primary care provider, and they can make the referral.
Okay, good. And is insurance taking care of that, or how is that process work?
Well, the monoclonal antibody, there's no cost on that. That's been provided by the federal government.
Amazing.
So the only cost is for the infusion itself, for the saline, the tubing
Perfect.
That's used.
Perfect. So tell people where the Incarnate Clinic is and how they can connect.
It is on 3000 South MacArthur Drive. It's right next to Walk-Ons, across the street from Johnny Carino's. And I would encourage them to try to see their primary care providers first, so that they can, because they know their medical history, they're going to know if they are at an increased risk.
Sure.
And they may be able to order the labs.
Very good. Dr.
But
Zapatero,
they can,
thank you so much for all that you're doing, being on the front lines. May you stay well and safe all year long.
Thank you. And thanks for getting the word out so that people can take the proper precautions.
Absolutely. Hey, everybody, stay on point. We're back with more right after this.